Hello everyone and welcome. The Center for Medicare and Medicaid Services is pleased to present this program today entitled Medicare Part D, Its Impact on Nursing Home Surveys. I'm Deborah Swinton Spears, nurse consultant for the Division of Nursing Homes here at CMS, and I will be your moderator for today. The purpose of today's program is to provide information that will prepare CMS regional offices and state surveyors to respond to the changes that will occur following the implementation of the new Medicare prescription drug plan, which begins January 1, 2006. During this broadcast, we will give a brief overview of the Medicare Modernization Act, describe the new Medicare prescription drug benefit, more commonly known as Medicare Part D, identify how the Medicare prescription drug benefit will impact Medicare enrollees who reside in nursing homes, and describe the roles and responsibilities of the facilities and surveyors in the presence of the new Medicare prescription drug benefit. To provide an example of what could happen following the implementation of the Medicare prescription drug benefit, we have prepared a brief scripted video which we will share with you during this broadcast. Now that I have given you an overview of what you can expect today, let's get started. But before I introduce the members of the panel, Thomas Hamilton, our Survey and Certification Group Director, would like to welcome everyone to today's program.
Hello, I'm Thomas Hamilton, Director of the Survey and Certification Group in the Centers for Medicare and Medicaid Services, or CMS. I would like to welcome you to this satellite presentation on the new Medicare Prescription Drug Plan. The Medicare Prescription Drug Improvement and Modernization Act, or MMA, was signed into law on December 8, 2003. It represents the most extensive expansion of Medicare since the original creation of Medicare in 1965. On January 1, 2006, the prescription drug coverage under Medicare will begin. The program will offer Medicare beneficiaries the ability to choose from a variety of options for their prescription drug coverage. This is a great opportunity for Medicare beneficiaries, particularly for those who did not have prescription drug coverage previously. As surveyors, it is not your responsibility to provide education on Medicare drug coverage for nursing homes, but rather to survey for compliance with the pharmacy regulations that provide for a safe system of medication administration and for compliance with the residents' rights. At the same time, it is very important for surveyors to understand the Medicare prescription drug benefit and what it means for both providers and beneficiaries. Nursing homes may face certain challenges due to the need to contract with more than one pharmacy in order to provide the plans of choice for nursing home residents. And the various plans available will affect the manner in which enrollees living in nursing homes receive prescription medications. Today's program is therefore intended to provide considerable information for state and regional surveyors on the implementation of the new prescription drug plan. In today's broadcast, we will provide an overview of the new Medicare prescription drug plan, identify how nursing home pharmacy services will be affected, and discuss possible effects of the new prescription drug plan on nursing home residents and on fulfillment of regulatory requirements. Thank you for joining us today, and thank you for your commitment to improving the delivery of services and support to residents in our nation's nursing homes.
Thank you, Thomas, for that warm welcome and for providing this opportunity to share this important information with our CMS regional offices and state surveyors. Time will not permit taking calls during this broadcast. However, I would like to provide you with contact information for any questions or comments you may have regarding the Medicare prescription drug benefit following this presentation. Please send your questions or comments to SCG_DNH_Medicare Part D at cms.hhs.gov. That's SCG_DNH_Medicare Part D at cms.hhs.gov. Now I'd like to introduce the members of the panel. With us here today, to my right, and I am pleased to introduce Dr. Nicole Brandt, a pharmacist consultant with CMS's Division of Nursing Homes here at our central office in Baltimore, Maryland. And I am also pleased to introduce today, to my left, Dr. Denise Stanley, who is a pharmacist with CMS's Policy and Inquiry Branch at our Region 4 office in Atlanta, Georgia. Welcome, Nicole and Denise. Nicole, would you please begin by sharing with our audience an overview of the Medicare Modernization Act and an introductory description of the Medicare prescription drug benefit?
Sure, Deborah. As Thomas Hamilton mentioned, this is the largest expansion of Medicare over the last 30 years. This is a very exciting time because Congress and the administration brought forth this landmark legislation, which provides people with Medicare a prescription drug benefit, more choices, and better benefits under Medicare. One goal of the Medicare Modernization Act, or MMA, is to provide relief to states by transferring drug coverage away from the state level, as well as implementing cost-saving tools. In addition, MMA moves toward preventative benefits and promoting individual responsibility through education. It also moves towards ensuring quality, efficiency, and effectiveness through pay for performance. Beginning January 1st, 2006, the new Medicare prescription drug benefit will be available to people with Medicare Part A and/or Part B. The Medicare prescription drug benefit will be provided through multiple types of private plans: standalone prescription drug plans, Medicare Advantage prescription drug plans, and other Medicare health plans. Standalone prescription drug plans will provide only the Part D benefit. Medicare Advantage prescription drug plans will provide a comprehensive medical benefit that includes the Part D benefit. Other Medicare health plans include Medicare cost plans, demonstration projects, as well as programs of all-inclusive care for the elderly, also known as PACE. A variety of Medicare prescription drug plans are available in your area and will start providing benefits beginning January 1st, 2006. Information about these plans is available at 1-800-MEDICARE and on www.medicare.gov. On the website is the Medicare Prescription Drug Plan Finder, which can assist Medicare beneficiaries, families, and care providers in understanding and comparing the plans in their area. Each plan will have a different formulary. The plan must have multiple drugs in each class, and CMS will be overseeing the formularies to prevent inequalities among certain population groups. Here is what we know to date. Plan formularies include both brand and generic prescription drugs, insulin and associated supplies, parenteral nutrition, vaccines. Plan formularies exclude drugs covered under Medicare Parts A or B, and drugs excluded by statute, including benzodiazepines, barbiturates, and over-the-counter medications. Medicaid may continue to cover these drugs, excluded from the Medicare prescription drug benefit, and not otherwise covered under Medicare Part A or B. It is important to remember that current Medicare beneficiaries can enroll between November 15, 2005 and May 15, 2006. If they enroll by December 31, 2005, their coverage will begin January 1, 2006. Beginning January 1, 2006, drug coverage for Medicaid-eligible individuals will shift from Medicaid to Medicare Part D. Individuals who are dually eligible for Medicare and full Medicaid benefits will be automatically enrolled in a plan so that they do not experience any interruptions in their prescription drug benefits. These individuals will receive automatic enrollment notifications beginning November of 2005. These individuals can choose to remain in the plan to which they've been randomly assigned, or they may select one of the other various plans. Therefore, many of the residents in nursing facilities may have already received an automatic enrollment notification letter. It is important for residents or their representatives to review the features of their assigned plan, especially in regards to the comprehensive nature of their formulary. Of note, there will be no premiums or copays for nursing home residents who are eligible for both Medicare and full Medicaid benefits. It is also important to evaluate if an individual is eligible for additional subsidy or extra help. The extra help will reduce members' premium and cost-sharing obligations. Individuals who have not been deemed eligible for the extra help can apply at a local Social Security Administration office or with a state Medicaid office. For more information about Medicare prescription drug plans, visit www.cms.hhs.gov or www.medicare.gov or call 1-800-MEDICARE. That's 1-800-633-4227.
Thank you, Nicole. This new law under the Bush administration with improved health insurance plans will strengthen and modernize our current Medicare programs. While this is a great opportunity that will apply to all individuals enrolled in Medicare, it will require some changes in the way nursing home residents receive pharmacy services. How these changes affect individual residents will vary. It is for this reason we would now like to focus your attention specifically on our Medicare enrollees who reside in nursing homes. Our focus begins with Scene 1 of our brief scripted scenario that we would like to share with you now. Let's take a look.
Yes, who's there?
Good morning, Mrs. Dunn. It's Suzanne, your nurse. May I come in, please?
Yes, come in.
Great. How are you doing today? I have your medication. Let me check something very quickly. Okay, great. Here you go. And here's some water.
Okay. Why is one of my pills different? Are you sure these are my medications?
Yes, Dr. Harris has changed one of your prescriptions because he doesn't want you to pay so much for your medications.
Okay. Yes, come in.
Hello, Mrs. Dunn. I am a surveyor with the Health Department. We are here this week inspecting the facility, and I wondered if I could take a few minutes of your time.
Who are you again?
My name is Elisa, and I'm a surveyor with the Health Department, and we're here inspecting this facility for the whole week.
Oh, I see. Please have a seat.
Thank you. I overheard you talking with your nurse about your medications. Do you remember when you first noticed the change?
I think it was more than a week ago. Now that I think about it, it changed about a week before I began feeling dizzy.
Are you feeling dizzy now?
No, I'm not feeling dizzy now, but for the past week it has been almost every day.
Do you tell the nurse when you feel this way?
Yes, I do tell the nurse, and when I do, she gives me a small pill, but I'm not sure. I think it's for my dizziness.
Thank you, Mrs. Dunn. Hi, Mrs. Gardner. Have you seen Mrs. Dunn's chart? I was looking for it at the nurse's station.
Yes, I have it right here. I'm sorry. I didn't know you were looking for it. And please call me Suzanne.
Thank you, and you may call me Elisa. While I have you here, Suzanne, has Mrs. Dunn been complaining of feeling dizzy, or has she fallen recently?
I have noticed she's been unsteady at times, but I don't recall any falls. And actually, if you'll excuse me for a minute, I have a treatment to perform, but I will be right back, okay?
Okay, thank you.
What else can I help you with?
I was wondering if you have assessed Mrs. Dunn's new medication, quetiapine, for potential adverse effects.
No, I have not, but somebody else on the staff might have.
And do you know what her last blood pressure reading was? I couldn't find it in her chart.
It looks like her blood pressure has not been taken for about 3 days. However, her last reading was 150/88. And this chart does not indicate that she's been assessed for any potential adverse side effects for the quetiapine. However, she has been prescribed meclizine PRN for her dizziness.
Could we walk down to Mrs. Dunn's room now and check her blood pressure reading?
Sure, not a problem.
Good.
Yes.
Mrs. Dunn, it's Suzanne, your nurse. May I come in?
Yes, please come in.
I have Elisa. You remember her, the state surveyor that came to speak with you earlier today?
Yes, I do. Yeah, hi, Lisa.
Now I'm going to take your blood pressure, and she's going to observe if that's all right with you.
That's fine.
Okay, now I'm going to take it sitting down and standing up. You do remember that, right?
Yes, I do.
Okay, now if you feel dizzy when you stand up, I want you to be sure to let me know, okay? All right.
Yes.
Okay, Mrs. Dunn, your blood pressure sitting down was 140/77 and standing up 118/66. And just to let you know, Dr. Harris is going to be coming in to speak to you later on this evening about your dizziness, okay?
Oh, thank you.
Well, I know how much of a concern it's been for you, and we want to get this fixed, okay?
Mm-hmm.
Are you ready? Okay.
Well, now that we have viewed this first scene of the video, Nicole, what did you think about the facility's response to the residents' symptoms?
Well, Deborah, it is important that any new symptom presenting in a resident be considered a potential medication side effect until proven otherwise. Heightened awareness needs to be taken towards medication changes, which may lead to unnecessary treatment of side effects. This is commonly known as the prescribing cascade.
Nicole, it's also important for surveyors to be aware of the possibility of residents receiving unnecessary drugs. This involves drugs given without adequate indications for use and/or lack of monitoring.
Nicole and Denise, those were great points. We should also note that although the scene gave a good example of what requires follow-up evaluation following drug formulary changes as a result of Medicare prescription drug benefit, the intent was not to suggest that the dizziness experienced by the resident was absolutely the result of the drug substitution. The intent was to direct further investigation by the surveyors to determine whether there may be a connection between the two and whether the facility took the appropriate steps to promote the residents' optimum well-being. In this next scene of our video, the surveyor continues to investigate the resident's medication substitution as well as the resident's complaint of dizziness. How will the facility respond to the medication formulary change and the surveyor's investigation? The scene begins with the surveyor interviewing the facility's director of nurses. Let's take a look.
Hi, Elisa. Susan told me that you wanted to meet with me.
Hi, Faith. Yes. When I interviewed Mrs. Dunn, she told me she had been complaining of feeling dizzy for the past week. Are you aware of this?
Susan said that Dr. Harris did prescribe something for that.
Did anyone on your staff assess Mrs. Dunn to determine whether there was a relationship between her dizziness and a formulary change?
No, but Dr. Harris is here today. Would you care to speak to him?
Yes, I would. Thank you.
Hi, I'm Dr. Harris. I understand that you have some questions about Ms. Dunn's drug regimen.
Hi, Dr. Harris. My name is Elisa, and yes, I do have a question. I spoke to Mrs. Dunn, and she told me she had been complaining of feeling dizzy for about the past week. After reviewing her medical record, I noticed that she had had a medication change about that same time from olanzapine to quetiapine. Now I'm wondering if her dizziness might be related to her change in medication.
I was planning on seeing her today. Let's go do that now, but you know, I spoke with Suzanne about Ms. Dunn's dizziness, and I had ordered PRN meclizine, but we can test whether there is a problem with the drugs. Let's discontinue the quetiapine, and then we'll resume the olanzapine. However, that will require a formulary exception.
I understand that Dr. Harris came to speak with you a little bit ago. He has decided to change your medication back to the olanzapine, the medication you were taking before you began feeling dizzy, because he wants to see if the switch to the quetiapine is what's been causing your dizziness, okay?
Wonderful. I don't like feeling dizzy.
I understand, Mrs. Dunn.
Okay, thank you.
Hi, Mrs. Dunn. I see you're up and about today. How are you feeling?
I'm feeling much better today. I can't talk to you right now. I'm off to play bridge.
Have fun. Oh, hi, Suzanne. Are you assigned to Mrs. Dunn today?
Yes, I am.
May I speak with you a moment?
Sure. Let me lock this up, okay? And just give me 1 second.
Okay, thank you. Suzanne, when I reviewed Mrs. Dunn's medication record, I noticed her olanzapine had not been initialed as given for 3 doses on the MAR. Did she get her medication?
No, she has not gotten the olanzapine. It has not come in from the pharmacy yet.
Does it normally take the pharmacy 3 days to get your medications?
Actually, no. Normally it comes within a few hours of the request.
Thanks. I'm going to go speak to the DON.
Okay.
Faith, I'm looking at Mrs. Dunn's medications. Can you tell me why she did not get her olanzapine for the past 3 days?
Oh, that's the drug that we're waiting for the exception because it was not on the formulary.
Are you aware that the residents should continue to get their medications while any exceptions or even appeals are in process?
Oh no, we didn't know that. But what if the exception is denied? Then who will pay for the drug?
Now that we have seen the continuation of the script in Scene 2, Nicole, what do you think of the facility's response to the surveyor's question in this scene?
Deborah, the scene suggested some uncertainty by the facility about their responsibility in the presence of the new prescription drug benefit.
Yes, Nicole, it did. However, the facility is always held accountable for having an advanced understanding of their responsibilities with regards to the care of their residents, even following the implementation of the new Medicare prescription drug benefit. Denise, what about the surveyor's responsibility?
Deborah, the surveyors must not accept the lack of knowledge as an excuse for failing to comply with any regulatory requirement.
Denise, to help our audience better understand the roles and responsibilities, would you please expand on how the implementation of the Medicare prescription drug benefit will impact our nursing home residents, the facility's responsibilities, and our nursing home surveyors?
Sure, thank you. The way pharmacy services are delivered to nursing home residents will change under the new Medicare prescription drug benefit. However, the facilities will continue to be responsible for assuring timely pharmacy services as well as medication delivery in a timely manner. The facilities will continue to ensure the pharmacy regulations, which include pharmacy services, procedures, consultation services, labeling and storage of drugs and biologicals are followed correctly. The initial change for staff will be preparing to assist residents in enrolling in the Medicare prescription drug benefit, that plan that best meets their particular needs. Secondly, in order to educate the legal representatives and physicians, the staff should familiarize themselves with the exceptions and appeals process. In the event that medication regimens are changed to include non-formulary drugs, this will help alleviate the possibility of residents not receiving medications based on formulary issues and disputes. The Medicare prescription drug benefit requires the prescription drug plans to have in place a transition process for all individuals transitioning from other coverage and whose current drug therapies may not be included in their prescription drug plan's formulary. For residents of nursing homes, plans will be required to cover an emergency supply, better known as first fill, of non-formulary drugs while an exception is being adjudicated. This temporary fill will be covered at the formulary brand copay. The facility will be notified of the non-formulary fill to inform them of the need to make a therapeutic change. The medical provider may complete an exception request to obtain the non-formulary drug. The physician must submit a supporting statement with the exception request that explains why the resident needs the non-formulary drug instead of the drug covered by the plan. After the transition time has passed, plans will only provide residents with non-formulary drugs if approved under the exceptions process. An exceptions request may be filed under the standard or expedited process. A plan must expedite a request if it finds or the resident physician indicates that applying the standard time frame may seriously jeopardize the resident's life, health, or ability to regain maximum function. If expedited, the plan must notify the resident of its decision within 24 hours. If standard, the plan must notify the resident of its decision within 72 hours. If the plan's decision is unfavorable, the resident or representative may request an appeal with the plan, which is called a redetermination. The appeal may be filed under the standard or expedited process. If expedited, the plan must notify the resident of its decision within 72 hours. If standard is appropriate, the plan must notify the resident of its decision within 7 calendar days. It is very important for facility staff and surveyors to understand that during the exception process, the plan is not responsible for the cost of the medications beyond the initial emergency or first fill supply. Instead, the facility is financially responsible for the resident's supply of the disputed medication during the exceptions and appeals process. This is in accordance with the present nursing home regulations. It is also important for staff to understand that all Medicare enrollees entering or residing in nursing homes will have an opportunity to change their plan enrollment each month. Surveyors need to understand 3 key points. Medication delivery to residents should continue to be received timely without causing residents any discomfort or danger to his or her health and safety. Medication delivery continues to be the responsibility of the facility to ensure the right medication is given to the right resident at the right dose at the right time through the right route, and the awareness of the potential for an increase in medication errors or adverse consequences. Surveyors need to be vigilant in ensuring residents get their medications, but also ensure no duplicative or inappropriate doses are given. This is important since there may be a possibility that more than one pharmacy may be supplying medications to the facility.
Thank you, Denise. We should note that the details described by Denise on coverage determination, exceptions request, and appeals processes also apply to residents with cognitive limitations. The long-term care guidance, which can be found on the CMS website, states that since many enrollees residing in nursing homes may have cognitive impairments that may preclude their ability to participate in coverage determination, exceptions request, and appeals processes, it is important to note that an appointed representative is allowed to act on the enrollee's behalf. An appointed representative can be any individual or entity chosen by an enrollee or authorized under state or other applicable law to act on his or her behalf in obtaining coverage determination or with any level of the appeals process. For instance, an enrollee may choose an agent of the long-term care facility, such as a registered nurse or social worker, to act as his or her appointed representative as long as the selected individual is willing to accept the appointment. To summarize, here's what we know. On January 1st, 2006, when the new Medicare prescription drug benefit begins, how pharmacy services are delivered will change. However, facility responsibilities will not change. The facility is responsible for obtaining residents' medications from the pharmacy in a timely manner. The facility must ensure that residents receive needed medications during exceptions and appeals processes. Surveying for compliance with nursing home regulations will not change. Surveyors will continue to monitor the way facilities deliver necessary care and services to the residents without regard to the type of insurance plan coverage or who holds financial responsibility for those services. For example, if the resident does not receive a necessary medication, the facility can be cited at quality of care, pharmacy services, professional standards of quality, or any other applicable regulatory tag. In closing, our overall goal to promote a safe, efficient, and cost-effective medication delivery system to all long-term care residents continues unabated. This medication prescription drug benefit will not preclude compliance with the regulatory requirements which were established to attain and maintain those goals. This concludes our broadcast. We would like to express thanks to the cast and crew who helped to make this program possible and the audience who took the time to receive this important information. We hope that it has been helpful and informative. This broadcast can be viewed in its entirety on the internet at cms.internetstreaming.com for 1 year through November 3rd, 2006. If you prefer a videotaped copy of this program, they can be purchased from the National Technical Information Services at 5285 Port Royal Road, Room 1008, Sills Building, Springfield, Virginia, 22161. The phone number there is 703-605-6186. For additional information about Medicare prescription drug benefit, please call or visit www.cms.hhs.gov or www.medicare.gov or call 1-800-MEDICARE. That's 1-800-633-4227. Again, on behalf of myself and the panel, we would like to thank all of our viewing audience for participating in this broadcast. Thank you.